want to bring to the planet in the next season, and that is the Evolution of Medicine Film Festival. And you can see the details up on the screen right now. So about 3 years ago, I spoke at a conference, and one of the other guys speaking there was Dr. Jeff Glad. You've seen him on the Functional Forum before, and he had pulled off a screening of this film, Escape Fire, and as a result had got about 60 new patients from doing it. And I just thought, man, this is such a good idea. When I saw that film, what I realized is that this film, unlike any other film that I've seen, is an unbelievable asset at transferring the feeling that's necessary to get people to want to do integrative medicine. So later on, in October 26th to 29th, we're going to do the first ever annual Evolution of Medicine Film Festival, where we're going to empower practitioners and groups of practitioners like you to put on a film screening, invite people from the local area, and take all of those patients into your practice. We're calling this segment unofficially 100 New Patients by Halloween. Who wants it? You can jump in now. So on the line here, I have a couple people who know this quite intimately. So early on in the year, one of our favorite people at the Functional Forum, Gillian Byrne, did a test run for us with a different film called Trace Amounts. And Gabe, my partner, actually had an opportunity to be at that film. So Gabe, give us a little rundown of your experience of actually going to a film that was put on by a group of practitioners and the experience of being there.
Hey, James. Yeah, it was really exciting. I mean, you know, technology never existed to where you could just gather a bunch of people together to see a big screen, like a film in a movie theater, but the type of film that, you know, you would have control over what's shown. So it was an amazing experience. I mean, it was really smooth. You know, Dr. Hoffman and Jillian, they ran it, and you know, basically one of the most exciting parts for me was we saw a great movie, Trace Amounts, but the audience wasn't just typically when I see these types of movies, I'm either sitting alone at home, or I'm sitting with you, or I'm sitting with a few other people who already are part of this community and understand these truths about medicine and healthcare. And usually when I watch them, I end up feeling very frustrated because I just know, you know, my family and so many people that I care about and people that I don't even know are not exposed to this type of information. So one of the things that really stood out to me about that experience was sitting in a movie theater full of people who were being exposed to this for the first time. They didn't know anything about it, and they were seeing it in a really just a real way where it's on the big screen. It has all the credibility of being in that environment, and they're being exposed to some really incredible information. I mean, that the first time I learned these types of facts or this type of information about health and what's going on in the world and the medical community, and you know, it was very confusing and kind of painful and frustrating. So, you know, to share that experience with them was amazing. And also, I didn't leave feeling as frustrated as I usually do because I knew I was in a theater with people who really needed this information, and it felt, rather than feeling helpless, it felt very empowering to be in a community of people who were learning something that was really going to affect their lives. And then we did some Q&A after the show. They got to connect, and they were all looking for function. I'll tell you right now, at the end of that show, at the end of that movie, people were raising their hands and were saying, where can I find a doctor who understands this information? I mean, without a doubt, people wanted to know, how do I find doctors that understand this or know this? So it was very different than my typical experience of watching a movie like Escape Fire or Trace Amounts.
Awesome. Yeah, that's exactly what I want to see, the power of communities right there. Now, Tom, I know that you've done this with this film very successfully in the past too, and this is something that, you know, over conversations of you and I, we talked about. Can you share a little bit with the audience your experience of putting on Escape Fire for a group of people that haven't seen it, and what the sort of results of that was to the doctor that put it on?
Yeah, to provide a little context, I was using that film, that specific film, in an effort to essentially launch new membership-based medical practices. So these are practices that are charging patients an annual retainer for becoming a member of the practice. And so anyway, the first time I ever tested it out was in Connecticut, and with a practice launch, and it went astonishingly well in terms of putting patients in a frame of mind to understand that they were, in joining the practice, they're not just doing they're not just doing something for themselves, but they're participating in a larger movement that's important to healthcare, and what they're doing is something significant. And so that film launched that practice, it was probably the most successful practice launch I've ever been a part of, actually. So we then went on. We got so serious about it, we actually ended up contracting with Aaron Martin, who's sort of one of the physicians that sort of stars in the film, to come out and co-host the events with us, and we wound up doing a good number of them in different places around the country. Hugely powerful tool to launch a practice and communicate a message. And I'll tell you, even this film, the trailer itself is like an infomercial for what functional and integrated practices do. It's a beautifully done trailer that I mean, I've used that trailer in speeches dozens of times at this point. So yeah, this is a great idea.
You know, one of the things that's really frustrating to me, Tom, is that you would go to an audience of physicians, and I speak to physicians all across the country, and I'm like, who's seen Escape Fire? And not every hand goes up, and I'm like, this is an asset that was perfectly designed to train everyone that watches it to come into your clinic. Let's just use this asset, and Tug has made this asset available so that you can do a film screening. I mean, it's so easy to to get that kind of momentum now. Am I right in also thinking, Tom, that there's a strong corporate wellness play in the movie that could be really powerful for physicians who are putting it on?
Well, there's a whole segment on Safeway and just the ability of an employer to kind of create health in their environment. And so yes, I think this would be a film that is as relevant to business executives and people who underwrite health plans as it is to individual patients.
So you could literally go and get like the Chamber of Commerce list of all the people that are businesses in your community and just invite the people off that. I mean, it's a no-lose plan. So one of the reasons why we're doing this is because it is so easy to do this now. You go to, if you want to go, if you see the sign now, we'll put it up on the stage here. You go to goevomed.com/film. So write that down, goevomed.com/film. And there you'll be taken to this page that actually shows you where you can sign up. Now, there are two options. You can do it in a movie theater, and it's completely free. You just say where you are. You have to let them know that you came for the Evolution of Medicine, and you can do a theatrical release, and that's completely free. You just have to sign up enough seats in order to make the whole thing run. I think it depends. It could be like somewhere from 50 to 60 seats, but ideally you're going to be getting hundreds and hundreds of people there. I think Jeff Glad ended up having 200 and signed up 60. So that's a pretty good number there for you. So if you go there, you can do that, but you can also do it in a non-theatrical venue, but then you actually have to pay to have the movie to use it for your non-theatrical venue. So the different options there. Just make sure that you tell them you come from the Evolution of Medicine. From Evolution of Medicine. Now, if you look and you go on to Tug and you see that, if you go to goevomed.com/film, you'll see that we're already completely dominating. Because it's happening October 26th through 29th. The sales of those tickets don't go live until September 22nd. We've got meetups in Utah and Illinois and Texas and California. So there's tons of meetups going up already. And especially if you're in a group of practitioners, this is a perfect time to flex the muscles. I said in the second season, now that we've got these groups together, let's use these groups to really make a difference and change medicine. And you know what? The only thing that it takes is the only thing that's freely available to everyone, and that's initiative. And I can't give it to you, but you have to take it. And so if you're watching this right now, take the initiative and do something awesome. So speaking of doctors who've taken initiative, it's our first special guest of the night, and this is a doctor who has been on the Functional Forum before. He is the second best looking psychiatrist in New York. It is Mr. Captain Kale himself, Drew Ramsey. Welcome, Doc.
Thank you very much, James. Nice to be with you guys.
You got your kale there?
Of course, I always have my kale. Don't you have your kale with you? I said before the forum, like everybody, you don't have any kale with you?
We just had some smoothies on the way in. I'm still feeling the buzz. So, Drew, these are out there, and you're wondering about Kale, and you want to know, you can go back to our podcast, one of the first podcasts and videos. I talked to Dr. Ramsey about why Kale is such a great tool for getting out ideas about nutrient density and holism and using all of the assets that we have to solve some of our biggest problems. But if there's one thing that I have to say about you, Drew, is that you've taken initiative and you've made impact. I mean, Beyonce is wearing a Kale t-shirt. Millions of people are harvesting and eating kale. And, more than anything, you've taken initiative to really make a difference. I applaud you. But what I really want you to tell everyone is when National Kale Day is this year, and what physicians who are listening to this or practitioners can do to use the momentum that you've created to position themselves as a leader in their local community.
Well, thanks so much, James. Just so everybody knows, I'm an integrative psychiatrist. I'm an assistant clinical professor at Columbia University, and I'm in private practice. Kale is a great way to get people excited because they're already excited about Kale. A lot of the folks in the functional medicine community, people who are our patients, they're very Kale friendly or they're Kale interested. October the 7th is National Kale Day, and it's just a really great way, like James was just talking about with the movie Escape Fire. This is another great way to get your community involved and let folks know about your practice. So there are a lot of ways that clinicians can get involved and should get involved. It's not just about Kale. I would say for all of us docs, it's about using the rules of Kale, as we call them, to help promote rules of healthy eating, namely nutrient density. So you can prescribe Kale on National Kale Day. Again, a fun way to engage with your patients. I've prescribed food and Kale to hundreds of patients in my clinical practice, and let me tell you, people always get a kick out of it. They are excited that you're interested in their food, and they're excited that you are kind of helping them understand one of these superfoods that a lot of people, they don't know what to do with Kale. So prescribe Kale, and to do that, we've got lots of tools for you. It's very easy to get them. You can see here nationalkaleday.org/KaleRx. On that, you'll get a couple of things. You'll get a nice graphic for your practice that you can put in your email blast or put up in your practice telling you all the health benefits of Kale. And then you also get a Kale prescription. But prescribing Kale could be even be sharing a shot of Kale juice with the patient. It could be mixing it up and helping patients solve a Kale problem, like not liking it, or a fun recipe for it. It could be giving out recipes. That's a great way to get involved. James, what we love seeing is the docs out there who host an event in their community, because this is really what we love to see doctors doing, and using Kale, again, just as a vehicle to start talking about eating more plants, eating more greens, what's the power of phytonutrients, and showing your community that you as a clinician that you're excited about that, and that that's part of how you practice medicine. So you can do that at one of these events. A Kale event is really simple. We're happy to help you out at National Kale Day. We've had events all over the country. In fact, the largest public hospital in Indiana has a giant field of kale growing on their roof. And I'm being serious. They harvest it, they feed it to their patients, they feed it to their staff, and they're hosting a huge event giving out 1,500 kale seedlings in their community. So you don't have to go that kale crazy. It could be as simple as, having an event with some kale smoothies, some kale salads, doing something with a local restaurant, doing something with a community center, or sending one of your staff members to maybe do a healthy cooking demo at your school. So all we ask is do something. Try and host an event, and when you do that event, let us know about it so we can help advertise and promote it for you. So finally, check out our Kale RX. It's a little package we put together for healthcare practitioners. You can see on the graphic a little bit of it here on the slide. It just helps people see some of the health benefits of Kale, emphasizes the nutrient densities, and all the amazing things you get out of this one leaf of Kale.
Awesome. Yeah, it's such a good idea. I've spoken about this on the forum before. I think a lot of practitioners are probably scared to go out and meet with people in their community, like you said, like the healthy restaurants or the health food store. Like every functional integrated provider should know all those people. But, sometimes it's awkward to go, hey, I'm this, and this is my clinic. Imagine coming at it at a different angle, like, hey, I'm putting on this film screening, I want to build community, or hey, I'm putting on this Kale Day, I want to, get you together. Then it's not so much about you, and you can just, have that initial bonding over something that's a third party, but you're developing those relationships, and out of those relationships come tons of referrals, getting in the newspaper, free PR. Like, this is a thing now. Kale's a thing. Beyonce's wearing the t-shirt. Drew made that happen just by taking initiative. If we could emulate the success of Kale Day with the Evolution of Medicine Film Festival, I would be thrilled, because you've made a real impact, and it's a real pleasure to to have you here on the Functional Forum again, Drew. Any final thoughts for our audience about getting people fired up about Kale?
Well, James, I just love what you said, which is that, it is tough sometimes for us as physicians to kind of get out into our community and promote ourselves. That was hard for me, and I can tell you that getting involved in Kale Day and kind of getting more involved in forums like the Functional Forum, it really does help drive a lot of traffic. My practice is busier than it's ever been, so I just really want to encourage everybody, get your Kale on October the 7th. Tomorrow, just talk with your staff, talk with another doc, make a commitment to do something, download the toolkit, and look, I can't wait to see you and all the Kale madness that you're up to in your practice on National Kale Day. Make sure and post it, #KaleDay2015, and we will see you then.
Awesome, Drew. Thanks so much. Dr. Drew Ramsey, he is author of 50 Shades of Kale. Some call him the Christian Grey of psychiatry, but I don't. So
just remember, James, don't get rough. Get roughage.
Get roughage. Oh, is that a new slogan for the new season? I like it. I think that's gonna really work. All right. So thanks so much, Drew. Thanks for being on, guys. Take a leaf out of Drew's book. He's really gone on to do some amazing things, having massive impact. That's what we're really looking for here at the Functional Forum. If we can inspire people to have impact, then we're definitely winning.
He's building community, James.
He's building community, exactly.
It doesn't matter. People, Kale Day, film festivals, the whole thing is how do you build community? Why is CrossFit a movement? Why is paleo happening? Why are people getting more educated about their health and then going to doctors who don't even know how to speak that language with them? It's because community is developing, and if doctors aren't the one building the community, somebody else is, and they're hanging out together, and they're looking for you. And so finding a way to step in like what Dr. Ramsey Drew did is, it's just great. It's a fun idea, but it's a way to bring people together and to expose them to a doctor who understands what's going on.
Exactly. If it's not you, it's going to be Lululemon. Like I said before, Lululemon has the running groups. It's going to be some corporate behemoth that comes in and is like, oh, it's going to be a fun run sponsored by McDonald's. We've seen enough of that crap, right? Yeah. It's time for the real guys to get involved and build community around it. So I'm really excited for what you're doing, Drew, and we'll be supporting that. The Functional Forum is October 5th, so we'll have another update on some of the cool stuff. If you're doing cool stuff for Kale Day, let us know. Speak to Anne, the community manager, and she'll post it up on our social media and let people know what they're doing. So definitely get involved. All right, it is time to move on. Again, we're going to talk about another one of our sponsors now. Last year we had Healthwave as a sponsor. We're very, very fond of them because of the adherence and other support that they give to patients and make it really easy to run a low overhead practice. But yet again, we have asked Healthwave this year to come up with a better deal for people that watch our show. We've got tens of thousands of practitioners that are watching. So that's, the beauty of you guys telling other people, and I know you guys are talking about the Functional Forum because more people are coming out of the woodwork to watch it. The beauty of that is the more people that we have on our team, the better deals that we can make with the sponsors or other things. So one of the things that they've offered for us is if you use other companies, other distribution companies, you're probably used to about a 30% margin compared to 50% margin if you're carrying it in practice. So Healthwave is excited to announce that anyone who comes to Healthwave from us, if you go to healthwave.co/functional or goevomed.com/Healthwave, you can go to either of those. They're offering a 40% commission if you use their new awesome iPad app or iPad app that you use in the practice. So they're really, really trying to make it easy for practices to make adherence and ordering of supplements easy. We're big fans of Healthwave just because we feel like if you are starting a practice from scratch, a low overhead micro practice, you need all assets at your disposal to make sure that you can keep overhead low and still have access to all of the products that you need. And Healthwave does a great job with that. So 40% as a commission on Healthwave is new, and go and check them out at healthwave.co/functional, and you'll always get the best deal here with the Functional Forum.
James, I think what you'll see with the tech, for example, with Healthwave, it's been shown and it continues to be shown that compliance is improved when you're able to offer this type of platform. And it's like we've talked about before. I mean, we're supplement neutral at the forum, but we're not saying one supplement is better than another, and that's a different conversation. But it's important to have technologies that improve compliance, that improve people's ability to follow a program, and we've seen that these platforms work. So community and compliance are like the two messages that I think, in this new season, more and more we're seeing that move to the forefront, be it through technology or through events that we're putting together. And I'm looking forward to seeing how those two things come together.
Absolutely. And if you're interested in that topic, again, the first ever functional forum, I spoke about acting like we're winning. Go back and watch Gabe's presentation on the evolution of patient compliance, because it was all about really thinking about compliance as an outdated concept. We're talking about empowerment. We're talking about adherence, how we can really make that work. So that's what we're all about, and we're going to have tons of tools throughout the season to really switch the conversation from top-down medicine, from doctor above patient, the patriarchal relationship, to a very synergistic relationship, a partnership that is obviously the future of chronic disease management.
Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you. It's called the 4 Top Productivity Tools for Practitioners. And it'll give you some starting points on how to save time in your practice so you can focus on what's most important to you in your business and life. All you have to do is click on the link below.